Alrighty, we might have a couple stragglers, but I am just going to get started in the meantime. So hi everybody, I am Adam. I'm the co-op student here at Kawartha Care. And without further ado, let's just get right into week 3 of major joint rehab. And this week's focus is major joint rehab hip. So we're gonna be talking all about the hip today and hip pain. As always, if you have any questions throughout the webinar, please use the Q&A function or the chat function. And yeah, we're just gonna get right into it. So a little bit about the hip. Some common injuries to the hip are hip pointer, trochanteric bursitis, snapping hip syndrome. This is stuff I've learned about in school. I learned about it because, or we talked about it because it's one of some of the most common injuries. They're the most common injuries to the hip other than stuff like pulling a muscle. And so for today's routine, we're going to be doing the usual stuff. We're going to be going over 3 sets of stretches and 3 exercises. And again, I just want to reiterate, if there are any questions throughout, please use the Q&A function. So some quick anatomy of the hip before we get into it. The hip is it's a ball and socket joint, just like the shoulder, which we talked about in the first week. So there is a little bowl-shaped part, and then a bone will just sit on there like this. We talked about the shoulder not being a very stable joint. The hip is more stable than the shoulder just because we do have a lot more of these bigger muscles holding it in place from all these different areas. You can see here, I'm not sure if you guys can see my mouse, but there's these adductors here just in the middle. Those hold the hip in place. There's the tensor fasciae lata, there's the IT band, there's all these different structures that are holding the hip in place. So it's just important that we strengthen these muscles, but while ensuring that they are not too tight. So again, hip, complex structure, but it's more solid than the shoulder, but it's still important that we work it out and stretch it and everything. So some general reminders, we are going to perform about 12 to 15 reps for 3 sets of the exercises. So what this means is we're going to go through the motion about 12 times, and then we are going to take a break, do it 12 more times, take a break, and do the 12 more for a final 3rd time. For today's purpose, we're a little short on time as always, so we're just going to do 1 set, but normally you would do 3. For the timed exercises and the stretches, we want to hold them for about 15 to 30 seconds is kind of the magic area. If you don't hold it for that long, you're not really seeing much benefit. And if you hold it for longer, there's not really much additional benefit for holding it longer. So there's no point in sitting in a stretch like all day. That can actually probably lead to more likelihood of an injury. So you just want to hold it for 15 to 30 seconds. That's the sweet spot. And as always, I'm going to talk about a couple ways to change the intensity if you need it to be a little more intense, a little less intense. It's a little difficult this week just because of the exercises we're doing and the way the hip has to be exercised, but I'll mention a couple throughout. And on that note, we can just get right into it. So we're going to start with some stretches, and then we will move on to some exercises. So I'm just going to adjust my camera here, make sure you guys can see me okay. Perfect. All right. So our first stretch today is something called hip openers. There's a bunch of different names for it, but hip openers are just the most plain simple way to put it. So we're going to do 12 for each leg. If you need to find something to hold on to steady yourself, that's completely fine. So the way these work is you're going to steady yourself. You're going to bring your knee up in front of you and bring it out to the side and then down. And that's one, and that's all it is. And then we're going to do the other side, hip up, out to the side, down. And that's 1 each leg. So we're going to do 12 each leg. So we'll keep going. So up to the side, down, up to the side, down. That's 2. And then as you go, it'll just keep getting smoother and smoother. And then you can eventually just kind of round out the motion. So here, this is 5 done, 6, 7, 8, 9, 10, 11, 12. Just double check everything here. Alrighty, if there are any questions, feel free to send a chat or something in the Q&A. But that's our first one. So the hip openers, 12 each leg, and then you're good. That one kind of acts more like a warm-up. It's great if you're about to go out and do some activity. You want to do those before. Just gets really, you go through the full range of motion, gets the blood pumping. It's really good. So our next one is something called the modified pigeon stretch. So the way this one works is you're going to take a seat. You can scooch the front edge of your seat. That's probably the best way to do it. And you're just going to take your foot and put it on your knee here. And then you're just going to sit, and you should feel a bit of a stretch on your side here, going a bit into your leg. If you want to feel a little more of a stretch, you're not feeling it too much, you can just kind of lay your palm here. And you don't need to push it all. You can just kind of rest it. And if you want to push a tiny bit, that's fine, but you don't want to be wrenching it down. Excuse me. Because that will lead to an injury. You just want to be resting your hand, adding a tiny, tiny bit of pressure just so you feel that tightness in your side hip. So we've probably been holding it for about 15 now. So I do like to ramble. So we are going to do both sides. So we'll switch foot on the knee, sit. You're just going to cross, and then you're going to, if you need, lay your palm right there and just feel the stretch. Probably going to go for about 8, 9, 10, 11, 12, 13, 14, 15. Alrighty, so our next one is called the side bend goddess. So the way this one works is you're going to scooch the front edge of your chair again. You're going to kind of spread your legs apart, almost as if you're trying to do a splits, but your feet are touching the ground. So you're going to spread your legs. You're going to bring your hands up and together, and then you're just going to lean to one side and hold it for 15. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Then we'll go upright, and then we're going to switch to the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Perfect. And you want to make sure, I have a tendency to try to kind of shimmy my legs back in while I'm doing that. You want to try to make sure that they are staying out and spread, so you are getting that good stretching. So that covers our stretches for today. So we did the hip openers, the modified pigeon, which was the sitting one with the hand, and then we did the side bend goddess. So if you guys have any questions about any of these, please use the Q&A function. If you need a reminder in a couple days, this is being recorded and it should be uploaded to our YouTube. Normally it takes about 2 or 3 days for us to get that uploaded. So now we are going to move on to our exercises. So our first one that we're going to do is called standing hip abduction. So this one is very straightforward. You're going to want to, again, grab something that you can balance yourself on. And then all you're going to do is take your leg. You're going to go straight out to the side, bring it back in. If you can only go that far, that's fine. Everyone's got to start somewhere. And really, it's important that you don't push yourself, because that's when you get hurt, when you start to push yourself out of your comfort zone. So it's just straight out to the side, and back down. So that's 2 we've done now. So we'll go for our 12, and then we'll switch legs. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Alrighty, and then we're gonna do our other hip this time. Again, normally you would do these in 3 sets, but just because of our time today, we're just gonna be going through 1 set for each leg. So I'm gonna face this way to give you guys a different view. And again, it's literally just straight out to the side, and in. No forwards, backs. It's just 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Perfect. All right, so that is our first exercise down. So now we're going to move on to hip marches. For that last exercise and this exercise, if you wanted a little more increased difficulty, a great way to do this is to have ankle weights on, just like grab some ankle weights, put them on your legs, and that's just a great way to increase the intensity. But if you don't need it, that's fine. A great way to lower the intensity is just to start off with lowering the amount of reps. So you could do maybe 3 sets of 8 instead of 3 sets of 12. But again, it's all personal preference. For this one too, there's a couple ways to modify it. You can either do it by counting the amount of steps you're going to do. These are called hip marches. So you can either do it by counting the amount of reps you want to do, or you can just say, I'm going to do this for 3 minutes and see how many you can get done in 3 minutes. But the way these work are you're going to sit down, you're going to scooch to the forward edge of the front edge of your seat, and then they're exactly like they sound. You just lift your leg up and put it down. That's one. And that's all. That's all it is. So just lifting your leg up. So for today, we're just going to do 12 on each leg. So we're going to count to 24, and then we'll call it. But again, a good way to do it is say, I'm going to do this for 30 seconds and see how many you can do in 30 seconds without rushing too much or anything. It's about getting through the motion at like a good steady pace. All right, so we've done 2. So 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Alrighty, so I think I was maybe a couple short there, but I think you guys get the gist of it. 12 each leg. Go for as long as you want, or just say, I'm going to do 12 steps, and then do it, take a break, do 12 more, take a break, do 12 more, as many as you want, just until you start to feel a little tired, and then you can feel free to stop at whatever point you're comfortable with. Alrighty, and so we've made it to our last exercise for the day. This one, kind of like the hip openers, is a bit more of a warm-up than the exercise, but these are just great. They encompass a whole bunch of different muscles, and it's super straightforward. So what we're going to do is we're going to stand. We're going to have our feet kind of close together here, same with our knees. I like to do this with my hands on my hips, just I feel like it gives me a little more control. But we're going to essentially move our hips in a clockwise direction about 12 times, and then we're going to go in a counterclockwise direction about 12 times. And that's all it is. It just activates a whole bunch of different muscles as we go around. Super great. So here we go. We're just going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Oh, 12. There we go. You kind of want to keep, it's almost as if you have something holding your head in place and your feet in place. And the only thing that's going in the circle is your hips. And you'll be able to feel all the different muscles around your hips activating as you're going in that circle. So now we'll go the different direction. I'm going to go counterclockwise. Here we go. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And that's it. That's great. That was our last exercise. Again, that one's a bit more of a warm-up. You can't really make it more difficult or easier. It's just another great thing to do, like the hip openers before you go out and do any activity, or after some activity too. It's also great. So we just have about 2 more slides here that we're going to go through, and then we can call it a day. Again, any chats or Q&As, please ask, and I will happily answer. Let's see, put these here. Alrighty, so a couple reminders just in general. You want to perform the exercises in about 12 to 15 reps for 3 sets. Again, if you want to lighten the intensity, maybe start off with something like 8 reps for 3 sets, or 10 reps for 3 sets. Whatever, you can lower the reps that amount. Just as long as you're doing it, that's a step in the right direction. Everyone's got to start somewhere. For the timed exercises and the stretches, you're gonna hold for about 15 to 30 seconds. You don't really get anything out of it if you hold for less than 15, and you don't really get anything additional out of it if you hold for more than 30. So you just kind of want to go with that window of time from 15 to 30 seconds. And of course, you can always change things for your difficulty. As you mentioned, for some of the exercises, you can add ankle weights maybe if you want to be more difficult, or you can just lower the amount of reps. Again, it's entirely individual and what your individual needs are. So looking ahead, this is our 3rd week. Next week is our 4th and final week of major joint rehab. So next week, we're going to be talking about the knee. We're going to be doing our usual thing, going over some of the anatomy, some of the common injuries. We'll be going over exercises, stretches. And then we will also have a poll next week asking you guys what you want to see for our 4-week series starting August 6th. So we'll have a poll for that, and you'll be able to find the answers to it up on our Instagram when we advertise about it. So yeah, we'll have some options out for you guys next week to post about, or to choose and give us some feedback on what you're interested in learning in. This webinar will be up on our YouTube. Normally it's up in a couple days. So if you need any reminders about what went on today, feel free to check that out. All you have to do is search up in the YouTube bar, Core Orthocare. If you want to find the specific one, if you search up Core Orthocare hip, you'll be able to find it, no problem at all. This month, we have a special going on in the clinic. It's 10% off massage rollers. They're great. They're like this, it's almost like a wooden dowel that you have, and then it's got a bumpy piece in the middle, and then you just roll it across your muscles. It breaks up scar tissue, it breaks up lactic acid buildups. It gets blood flowing to the muscles to relieve tension. It's really great. It's a great form of stress relief too. It's not just for muscle soreness. Like I said, it's great for stress relief. So definitely check it out. It's 10% off until the end of this month. Then they go back to their normal price. So I definitely urge you guys to check it out. And on that note, unless there's any questions, I think we are good to call it there, and you guys are good to go. So yeah, I'll just wait around for a minute, see if there's any questions, and then. Okay, I'm not seeing too many questions. I'm seeing a number of folks have left, so I'm just gonna call it there. Have a great weekend, everyone.